Cigarettes are really bad for your health. We all know that. But what about vaping? I'm talking about those small, compact devices such as electronic cigarettes, e-cigarettes, that heat a liquid that produces a mist or aerosol, which is then inhaled. Is vaping bad for your health? How bad is vaping really? E-cigarettes are not harmless. E-cigarette liquid usually contains harmful substances such as nicotine, heavy metals, ultrafine particles, volatile organic compounds, and known carcinogens such as formaldehyde that can have negative effects on lung health, cardiovascular health, and overall well-being. Studies of e-cigarette users have found higher rates of wheezing, worsening asthma, and increased incidence of respiratory disease. Since e-cigarettes were first introduced to the market in the early 2000s, there has been an alarming increase in vaping among young people. In fact, the National Youth Tobacco Survey reported a significant increase from 2017 to 2019, with over 27% of high school students reporting using e-cigarettes during the previous 30 days before taking the poll. More recently, in 2020, the Centers for Disease Control and Prevention reported that 3.6 million middle and high school students in the United States were current users of e-cigarettes. The popularity has been rising because there is a public perception that vaping is less harmful than traditional tobacco smoking. I'm not surprised that usage is increasing because aggressive marketing strategies target young adults, some of whom are susceptible to risk-taking behavior.
Menthol, your aggressive campaigning has led to generation on generation of learned behavior.
Plus, the artificial flavoring of e-cigarettes mimics fruit, dessert, and even beverages. Parents worried about their teens often ask me, is vaping addictive? The answer is maybe yes. Many vaping products contain nicotine, which is highly addictive. This addiction can lead to long-term use of e-cigarettes and potentially increase the likelihood of using traditional tobacco products, those that you smoke. Does vaping help people quit smoking? The public perception when e-cigarettes first emerged was that they could allow smokers to gradually reduce their nicotine intake over time and eventually quit. But now we know that vaping is not an effective tool to quit smoking. Studies have shown that vaping helps only 10% of smokers quit, which means that the vast majority of smokers who use e-cigarettes to quit were still smoking after a year. In fact, problems arise when people develop a new nicotine addiction or end up using both cigarettes and e-cigarettes at the same time. Does vaping cause secondhand smoke? This is an interesting question because we know that secondhand smoke from tobacco contains cancer-causing elements, including tar and carbon monoxide, which are harmful to the smoker and bystanders. But vaping doesn't really produce smoke. Instead, it produces an aerosol vapor containing ultrafine particles, flavorings, nicotine, and other chemicals. The potential health effects of exposure to secondhand vapor are still being studied, but we know it's not without risks. Some of the compounds are known carcinogens, like formaldehyde, that have negative effects on lung health, cardiovascular health, and overall well-being. Everyone should avoid the secondhand mist, especially children, pregnant women, and people with respiratory conditions. Is vaping a gateway drug? When parents ask me this, they are worried that vaping may lead teens to smoking tobacco. E-cigarettes can contain nicotine, which is highly addictive. And there is evidence suggesting that young people who start with e-cigarettes are more likely to progress to smoking combustible tobacco products or try other addictive substances. Look, parents, if your teen is smoking, do everything you can to help them quit immediately. If you're a smoker, quit immediately. If your child is vaping, try to get them to quit immediately. Talk to your healthcare provider about personalized guidance and evidence-based programs to help stop smoking and vaping. Different approaches work for different people. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, and join me here next time for Answers You Can Trust.